Wastewater data reveals 29 states reporting high or very high levels of COVID-19 cases as vaccine confusion is running rampant. Instead of recommending it for all adults, the Advisory Committee on Immunization Practices now advise shared clinical decision-making.
That means it's up to patients and their healthcare providers to decide together whether or not an individual should get a COVID-19 vaccine based on their risk. 70% of adults actually have one or more risk factors for a negative outcome from COVID-19 because they're overweight, because they have asthma, because they have high blood pressure, because they have diabetes or prediabetes. But your circumstances also matter. If you're a bus driver, if you're a teacher, if you work in healthcare, if you're a cashier and people are coughing and sneezing in your face all day, your daily exposure is going to be far higher than for someone who works at home.
So do we need a prescription to get the shot?
ACIP did not recommend requiring prescriptions, but because of unclear federal guidance and this patchwork of state rules that we have, access now varies by age, insurance, and can even vary by which pharmacy you visit. Important to know that if you're 65 or older or you have an underlying condition, you should still be able to get vaccinated without a prescription. But for younger or lower risk groups, the process may be harder. And that's especially concerning to me for the 26 million Americans who don't have insurance and don't have access to a regular doctor. For them, a prescription can become a barrier and not a safeguard.
And keep in mind,
the American College of Obstetricians and Gynecologists states that the COVID-19 vaccine is not only safe during pregnancy, but it's a critical way to protect the mother and the newborn from negative outcomes. And the American Academy of Pediatrics still recommends COVID-19 vaccination for children. A study just came out that shows that kids who got COVID twice last year were far more likely to develop long COVID.
There's also confusion about insurance coverage.
The major private insurers all came together and committed to covering all ACIP recommended vaccines, including COVID-19. So that covers about 315 million Americans. Public programs like Medicare, Medicaid, and anyone on an ACA marketplace plan will also continue getting COVID-19 vaccines free as well. But about 26 million Americans are uninsured, and I'm calling on and hope that state and federal programs will step in to help those uninsured individuals who often are at higher risk be able to get cost-free and easy access.
COVID is still a leading cause of death in the U.S., killing more than breast cancer and car accidents last year. Get more info at cveep.org and click on the Locator tab to schedule an appointment.